Well, hey everybody, Dr. Bulow here, and welcome to another episode of our Revive Videos series. Every week we try and come to you with some interesting information, some insights, and today I'd like to talk to you about this condition known as CTE. Now, this is really interesting information for those people that have brain-based symptoms, especially if they have a history of concussion or whiplash trauma, if they've played any contact sports that involve the head and neck, or if they've ever been in a car accident. This is going to be a really important video for those folks. Okay, so let's start right off and let's just talk about CTE and what it stands for. CTE actually stands for two separate diagnoses that I want to tell you about, and then I'll tell you why it's important and what might be causing your lingering problems after having these kind of injuries. So the first diagnosis kind of is a diagnosis of the overall symptomatology very often associated with repetitive head traumas, especially in football players. So in that diagnosis, CTE stands for chronic traumatic encephalopathy. Basically, it means you have inflammation in the brain due to repetitive traumas, repetitive head traumas. So chronic means it's ongoing, it's been there a while. Traumatic meaning multiple traumas that have been there a while, and encephalopathy is inflammation of the brain. So what types of symptoms can you expect from having a diagnosis of CTE? Well, very often they'll find this in NFL players that have had multiple concussions over the course of their career. But the symptoms can be a change in their mood, depression, anxiety, aggression even, decrease in memory. One of the first times we saw this that I had heard of CTE was in a football player who eventually had upper cervical care, and it helped him out a lot. But he talked about how he would go shopping, and then when he was at the store, he would call his wife and say, "I don't know where I am." I totally forgot where he was, not just what he was shopping for, but where he was located. So decrease in memory, that's a big deal. Decrease in cognition, problem solving, figuring out what the words are that you're trying to say. Doing simple math, balancing your checkbook, paying your bills. Things just don't come as readily easily to these folks that have had a history of concussion and trauma to their head. So chronic traumatic encephalopathy, first of all, right now is commonly known as, or CTE is commonly known as chronic traumatic encephalopathy. These people that have had a history of concussion and are dealing with the lingering symptoms. Now, there's another CTE diagnosis. Same acronym, different definition, which may be one of the causes to the first CTE that we just got done talking about. So the second CTE diagnosis stands for cerebellar, so the cerebellum, back of the brain, cerebellar tonsillar ectopia. The word ectopia means when something is located outside of where it should be located, right? So cerebellum is the back of the brain, tonsillar is the bottom of that back portion, and ectopia means it's basically sagging down into where the spinal cord is. Okay, so the brain should stay inside of your skull, but with people with this diagnosis of CTE, the cerebellum actually starts to sneak or slide or sag out of the bottom of the skull and into the top of the spinal canal. I kind of explain it like if you have a dish rag in a kitchen sink that's draining down into the sink. If you clog the sink or you put a stopper in the bottom of the bathtub, what happens to the fluid? What happens to the water? It backs up, it creates pressure. Well, when the brain sags into the spinal canal, what happens to the blood flow? What happens to the fluid inside of your skull? Well, in some cases, it can back up. So it can cause symptoms like an increased pressure. People who have headaches, they feel like their head's gonna explode, or that they have the headaches that bound every time the heart beats. Or maybe there's even a decrease in cerebral spinal fluid flow. The cerebral spinal fluid is what kind of washes and kind of cushions the brain. And if that's not pulsing the way that it should, maybe some of the waste products that the brain creates when it's active might stick around and stay inside of your skull too long. And that might lead to the symptoms of the first CTE. the mood changes, the memory changes, the cognition changes, right? The cognitive changes. Sometimes they are related, we feel like, most of the times. See, they did some research and found that people who were in a car accident were 2 to 4 times more likely to have the second CTE, where the brain sags. Now, let me ask you something. Do you think NFL players, when they get into head-to-head collisions, isn't that very similar to having a car accident? I would say so. So if you know somebody that's ever been in a concussion injury or ever been in a car accident, there's a good chance they may actually have this sagging brain, this pressure at the base of their skull or at the top of their neck. And in our opinion, if they don't get it corrected or helped, it might predispose them to the first CTE, the chronic traumatic encephalopathy. So not only is it really important to get checked on if you're having some of these concussion, whiplash type symptoms, but even if you're not, it's important to have it checked on so that down the line, your brain ages in the optimum way. So hopefully you've learned a few things, maybe some insights into your own health or the health of someone that you care about. Please feel free to share the video. You never know whose lives or whose life you may impact by just sharing it. And if you have any questions, please ask them. I'll be sure to answer them in the comment section below. Thank you, as always, for being a part of the community, and I look forward to talking to you next time. Bye now.